good day everyone. I am Dina Bacarisas and today we're gonna talk about the effects of smoking on the body. So tobacco is dangerous to our health. When you smoke, it doesn't just affect your lungs but also your entire body. Smoking can lead to a number of ongoing body problems as well as long-term effects on the structures of your body. Smoking over many years can raise the risk of a number of problems, and some of the body's effects are immediate. And there are 26 health effects of smoking on our body. First is mood stimulation, and also it can cause anxiety and irritability, smelly hair, unhealthy teeth, bronchitis, coughing, heart disease, high cholesterol, immune system, infertility, erectile dysfunction, diabetes complications, blood clotting, early menopause, poor vision, dull sense of smell and taste, lung cancer, constricted blood vessels, COPD or what we call chronic obstructive pulmonary disease, loss of appetite, yellow fingers, cervical cancer, wrinkly skin, problems with pregnancy and newborns, cancer connection, and increased risk of blood cancer. So those are the 26 health effects of smoking on our body. So around 600 ingredients are used in cigarettes, many of which can also be used in cigars and hookahs. According to the American Lung Association, as these ingredients burn, they produce more than 7,000 chemicals. Many of those chemicals are toxic and cancer is related to at least 69 of them. So there are 6 parts of our body that may be affected because of smoking. First is your central nervous system. Smoking can affect your central nervous system because one of the ingredients in tobacco is nicotine. In mere seconds, nicotine enters your brain and makes you feel more energized for a while. Yet, you feel drained and want more as the impact wears off. Nicotine is highly habit-forming, which is why it's so hard for people to stop smoking. Also, second, it can also affect your respiratory system. You're taking in pollutants that can hurt your lungs as you inhale smoke. This damage leads to a number of issues over time. People who smoke are greater risk of chronic, non-reversible lung problems, along with increased infections. And the third one is cardiovascular system. Smoking harms your whole cardiovascular system. Nicotine induces narrowing of the blood vessels, which limits your blood flow. Over time, the ongoing narrowing will cause peripheral artery disease, along with damage to the blood vessels. The next one is integumentary system, which are the skin, nails, and hair. Skin changes involve the more visible symptoms of smoking. In reality, substances in tobacco smoke alter the structure of your skin. A recent study found that smoking significantly raises the risk of carcinoma of squamous cells or skin cancer. Smoking increases the likelihood of fungal nail infections, and your hair also affected by nicotine. The fifth one is our digestive system. Smoking can also affect your digestive system. It has also an effect in insulin, making you more likely to develop resistance to insulin. This puts you at an elevated risk of type 2 diabetes and its complications, which appear to evolve more quickly than in non-smoking individuals. And lastly, sexuality and reproductive system. Blood flow to the genital regions of both men and women is impaired by nicotine. This decreases sexual output of males. For women, by reducing lubricants and capacity to achieve orgasms, this may result in sexual frustration. In both men and women, smoking can also lower sex hormone levels. This may potentially contribute to reduced sexual desire. Those are the 6 parts of our body which may be affected because of smoking. So, since smoking impacts every system of the body, Finding a way to quit is the most important step you can take to live a longer and happier life.